Next is the utilization review. The utilization management, the TSI president or vice president or designee will be responsible to do all reasonable procedures spelled out in the utilization management manual. TSI will have a policy and follow a policy regarding admissions, continuity of care, assessing services, medical necessity, and members' rights and responsibilities. TSI will follow policy regarding treatment planning, treatment reviews, and discharge planning. Best practice will be examined in the APA guidelines. Our policy will provide families with the opportunity to participate in a comprehensive mental health or individualized strength-based family functioning cultural responsive assessment to utilize the assessment supplied by the clinician or other clinical professional. Personnel will conduct an assessment that are qualified in relevant training, skill, and experience and have the ability to recognize individual and families with special needs. During the assessment, family members are considered the primary source of information. Information gathered for the assessment will be comprehensive, directed toward the concerns identified during the intake, and is limited to material pertinent to the meeting and requested and objectives. The social history will be contained in the file and will notate the following: client restrictions, collateral contacts, clinical tools used. Now, all diagnoses will be completed by licensed and qualified professional. A licensed professional diagnosing a patient shall have medical clinical knowledge of mental illness and utilize the DSM and also utilize Access 1 through 5 would be identified. Biopsychosocial information in the patient's family will be gathered during the assessment. Symptoms and behaviors would be identified. The Diagnostic and Statistical Manual for Mental Disorders will be utilized to assure that criteria for appropriate diagnosis is met. Our policy and clinical or interdisciplinary teams will assist and determine quantity of service, the appropriateness of admissions, discharges, duration of services, and needs that are related to the service. Procedures, we have a level of services will be determined on the basis of need. Areas will be utilized to determine appropriate level of services and types of care that would be needed, such as if they need a safety plan, crisis plan, etc. Progress toward alleviating symptoms and functional impairments have been made, but disorder is not in remission, and the individual capable of making any further progress. Another thing for our clinical criteria for continued services, there are reasonable expectations that the continued services would have clinical impact on the individual's social, medical, and occupational function. We also do have a policy for supportive services. The clinician must certify supportive services are medically necessary. I'm going to go back to clinical criteria for continued services. The policy is the clinical interdisciplinary team will assist in determining quantity of services and the appropriateness of admissions, discharge, and duration of services at this time. This is, in other words, a continued service review. We're determining levels of services based on their need. Are they making any progress? What services are being utilized? What's the risk management, the overall severity? What's the progress toward alleviating these symptoms and functional impairments? Have it been made? Are they in remission? Are they capable of making further progress? Progress toward the goals and objectives to alleviate symptoms and functional impairment. There is a reasonable expectation that the continuation of services will have clinically impact on the individual's social, medical, and occupational or educational functioning. We also do on supportive services. The clinician must certify that supportive services are medically necessary. TSI will get a release of information from the completed comprehensive assessment within 30 days of the client's admissions. Magellan at any time may review the client's treatment plan and treatment record to verify the evaluation, treatment plan, and certification of medically necessity are complete. Services provided by each client must be medically necessary in accordance to the prescribed treatment plan, and that's utilizing the DSM, stating that there is a serious function adaptability or impairment that is prohibiting them to function at the optimal progress. Services shall not be provided primarily for the convenience of the provider or the client. Okay, we already talked a little bit about discharge planning, but to kind of reiterate that TSI begins discharge planning at the time of admissions. The initial discharge plan is documented in the initial treatment plan, and continued planning will be completed. Discharge plan will be completed within 30 days of the client's discharge from the program. And the discharge will have at least a minimum of the final 5 diagnoses, discharge summary, goal achievement, techniques used with the discharge instructions, medication instructions, any follow-up appointments, restrictions for work or school, individualized crisis plan, and any recommendations to supportive services that are required or indicated. You can see this in Appendix A would be the members' and patients' rights. And we do have client consumer restrictions. It is TSI's policy not to restrict consumer rights in any way. The requirement restrictions must be designated or implemented to specific individual consumers only if there's written restrictions, and the restriction must be time limited and periodically reviewed. The process of informing consumers or guardians of restrictions of policy and procedures, the initiation of services or changes may occur. The requirement of prohibiting restrictions are used as punishment for convenience of staff or substitute for non-evasive programs. The requirement prohibits corporal punishment, verbal and physical abuse. Requiring restrictions are sued only for reducing and eliminating maladaptive behaviors identified to the restriction plan. The approval of the restriction is by the IDT. The documentation of all rights or restriction, the identification outcome previously attempted, less restrictive interventions. The plan are to restore rights and documentation, why a plan is not necessary, the training to reduce and eliminate negative behaviors. Okay, thank you.